the best of the week on Relevant Radio.
Fertility and infertility is such a hot topic. It seems as if everyone knows someone if you yourself aren't impacted. And my guest today is Dr. Susan Caldwell. She's a fertility and infertility specialist. She helps get to the root cause of what's happening with women's health. And as I've shared my story here before, I have 3 babies. Praise God, thanks to NaPro doctors such as Dr. Susan Caldwell, and a lot of prayer. So there's a lot of hope here. Dr. Caldwell, for those who maybe aren't familiar with NaPro medicine, I'd like if you could perhaps share a story of a recent patient you've worked with, of course, obviously anonymous, who has seen treating with NaPro so that people can kind of see it and work how that has helped with solving infertility.
Yes, I'm thinking of a patient whom I met. I'm thinking she was in her late 20s, married, had no children at the time. She had just gotten back from the IVF clinic, and they did, as they usually do, a evaluation, maybe some blood work, but it was a very kind of superficial evaluation. And the nurse told her, "You will never get pregnant without IVF. There's no other way you'll get pregnant other than IVF." So she was crying, and, and then she came to me, and I'm thinking, gosh, that's a pretty big statement, right? And this, and I took a history from her. There was nothing to say that, she had her tube, she had her uterus. There was no, it didn't sound to me like she had these structural abnormalities. I would understand if someone didn't have tubes, or they had some sort of a structural problem, but no. It was a bold thing to say. I'm like, oh my goodness. So sure enough, we started her charting. So NaPro Technology uses a charting method called Creighton Model System, where a woman is taught how to observe the signs, the biomarkers, through just the observation of her vaginal discharge. That's all she's doing, and she's looking at her mucus. She's looking at the different phases, how many days of her luteal phase, and she was recognizing all of these things on her chart, and some things were looking off. And I could tell just from her symptoms that she could have endometriosis, and from her chart. So she went to a NaPro surgeon in Houston who did multiple surgeries because she had very extensive disease involved, with endometriosis. And he released her back to me. I treated her with hormones in her luteal phase, and she had a beautiful baby girl.
Wow. Wow, yeah. That's incredible.
Yep.
And here's this woman, yet another woman being told you will never have a baby without IVF. It's a lie. There's no legitimate reason why she's not having a baby. And here's the result. I mean, there were things that did actually need to be treated that you were able to go in and see. Can you explain a little bit about the significance of NaPro surgery versus having a surgery done for fertility that isn't by a NaPro surgeon? Because I have a lot of hesitation when I'm talking to my peers about this, where they say, "Oh, I'm looking at getting this surgery done to help with infertility," and I always just want to say, please get a second opinion first from a NaPro doctor. Can you explain why?
Yes. Well, number one, it's the training, because you have to realize that an OB-GYN has a 4-year residency. And in those 4 years, that doctor has to learn an enormous amount about treating women. So not only are they learning how to do prenatal care, to deliver babies, to do surgeries such as hysterectomies and cesarean sections, but they're also, managing hormones. And it's a huge amount of information that they must learn. Okay. So what we know is that endometriosis, and not even just endometriosis, but surgical causes of infertility can be very, very difficult to, in other words, a doctor has to be thorough. And a doctor who has only done a handful of these cases, right, they're just not going to have the training. So, for example, I see this all the time. The doctor says, oh, sure, you might have endometriosis and I'll do a surgery for you. So they do what's called a laparoscopy, which is a minimally invasive technique, and sometimes with a robot, which is great. And they'll go in and they'll see a little bit of endometriosis, and maybe they will use a laser to kind of burn the lesion away, to vaporize the lesion, instead of doing an excision where they take out the entirety of the disease. And so sometimes, for example, if the lesion is on the bladder or the bowel, the surgeon will feel very uncomfortable touching those lesions because they are afraid that they might puncture the bladder or the bowel, right? That would be a terrible thing. But if you have a really good surgeon, such as a NaPro surgeon, they will have a team ready. Right. So they'll go in, they'll do an exploratory surgery. They will see that this is a much bigger problem. Right. And then they will organize another surgery to have a bladder surgeon, a urologist, or a bowel surgeon ready, so that when they take that disease out, if there is a injury to the tissue, that they have someone who is ready to back up and to take out. So I've had patients who have had to have bowel resections as part of their NaPro surgery because the disease was so extensive. And I've also had, surgeons, a patient's told, you just need a hysterectomy. The disease is so bad, you just need a hysterectomy. Yes. Yep. And then the patient went to the doctor that I, like to send people to. And yes, she did have to have several surgeries. But guess what? She didn't have a hysterectomy. And she, who knows if as far as I know, she doesn't have any children yet. But, she got rid of the excruciating, debilitating pain that she had. Yeah. There's so much healing that can be done.
I was recently horrified. I know someone who was having excessive bleeding. She'd had 3 children. She was okay with not having more children. She wasn't Catholic, but she was trying to figure out what to do because she kept being told, just go on birth control, just go on birth control. And finally, what she ends up deciding to do is she ends up just being cauterized so that she can't bleed anymore, basically. And logically, I'm sitting here going, but you were bleeding, and so now, am I correct in saying that blood is just internal now, and the problem hasn't been fixed, right?
Right.
You can join me and listen on the Relevant Radio app to Trending with Timmerie live each weekday at 6 p.m. Central. Thanks for listening.